Hi, this is Dr. Christopher Maloney, naturopathic doctor. I want to talk to you briefly about curing disease. So what happens is the patients will ask me a question. They'll say, well, doctor, do you think there's a time when I'll be cured of this? And my response is complicated because I will say, I believe there's a time that you will no longer experience any symptoms from this particular illness. But there's never going to be a time where you can basically ignore that you had this illness. So if someone has diabetes and it's controlled by diet, maybe we can get them. Well, probably we can get them actually, honestly, get their blood sugars normalized over a period of months and years. But they're never going to get to a place where they can say, hey, I'm going to have hot fudge sundaes 24/7 for the next 3 years and not think about it. So cure, in my mind, is getting to a point where you're no longer having symptoms. It doesn't mean you can't ignore the disease process. The trouble is that the majority of conventional medical practices consider cure to be the management of the disease using some kind of pharmaceutical drug or some procedure. So if you said to me, I'm obese, can you manage my illness? I'd say, yes, we can fix this. It'll take time, it's a process, you'll do it for your whole life. An MD might say, we're going to give you gastric surgery. The gastric surgery will work in a preliminary basis, but over time the body will gradually manifest more and more symptoms, and the overall weight loss from even gastric surgery is not as dramatic as you'd hope it to be. And in some cases it fails utterly because the person manages to bypass it somehow. That surgical procedure for me is a continuous management. What's far more common is you have high cholesterol, take this medication, it'll bring your cholesterol down. You have high blood pressure, take these 3 to 5 medications, they'll bring your blood pressure down. These are managing a disease. It's not curing an illness, it's management. If I wanted to cure an illness like hypertension, I'd have to look at all the different factors. I'd also have to look at whether the hypertension is simply a side effect of coming to see me. The average white coat syndrome is about 60 to 70 points of mercury, which means that a blood pressure of 120 might be as high as 190, depending on how stressed out the person is to come and see me. So that's really a factor within, do you treat the hypertension or do you treat the reasons for the hypertension? And for me, treating the reasons for the disease is the only way to get to cure as opposed to management.